Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 21 new cases of COVID-19 in Windsor and Essex County. Of the 21 cases, 8 are close contacts of confirmed cases, 2 are community acquired, and 11 are still being investigated. We have had 13,627 cases since the beginning of the pandemic. 12,973 cases are now resolved, and 253 people are active at this time. There are 49 preliminary or confirmed variants identified in Windsor-Essex, and 2 have the UK variant. 21 cases are currently in the hospital, and 4 people are in ICU. Our community has lost 401 people to COVID. There are currently 13 active outbreaks in Windsor and Essex County, 6 workplace outbreaks, 5 community outbreaks, 1 retirement home, and 1 school. Now for our vaccine update, a total of 67,789 doses have been administered to Windsor-Essex County residents. We are continuing to book our 80-plus residents and will complete vaccinations for all residents 80 years and older who pre-registered this week. As of March 22nd, yesterday, we had a vaccination coverage rate of 82.8% for our population that is 80 years of age or older. And it's really pretty impressive, and we're celebrating. That's quite good coverage right now. I mentioned yesterday that we will have a new booking system. This new booking system will launch today. I've been informed that our website is down right now, so please be patient with us as we transition to this new system. The booking system will go live at noon today. It will be eligible for people to book if you're 75 years of age and older. And you'll be able to book directly online, schedule your appointment at the location you want to attend for your vaccination site. There will no longer be a pre-registration of a phone call. You'll be able to, get everything right at that moment. If you don't have a computer or need assistance when booking, you'll be able to call a booking number, which will be live at noon as well. The number is 226-773-2200. With the support of the City of Windsor and Windsor Regional Hospital, booking agents will answer your call and assist you afternoon today. So just to reiterate that it won't be operational till noon today. The direct link will go out to our social media and other platforms. You will be able to go onto our website, but we're trying to avoid everyone coming to the website all at once, and so we will get it out there, and there'll be the ability for people to book. For general inquiries regarding the vaccination, please call 211. And just a reminder that Transit Windsor has kindly offered transportation services for those being vaccinated at one of our vaccine sites. So individuals who require transportation need to identify that they're going to receive their vaccine, and they'll be able to get a round trip free. So please visit the City of Windsor's website at citywindsor.ca to find Transit Windsor's schedules and maps. Their rollout at the pharmacies for AstraZeneca and people over the age of 60 or 60 years and older continues, and people can book at ontario.ca/pharmacy COVID vaccine, and our website has information as well. So that's it for now. Thank you.
We'll now take questions from the media. Is there any questions from Windsor Star?
Hi there. Sorry, I had a really hard time hearing that. I don't know if it's to do with your website or not, but I'm wondering, the fact that the website is down, is that connected at all to this new registration system?
Mike is saying it's not connected, but we will have the information on our website. So we are, he's saying that with the media release and pushing out the URL, people will be able to go directly into the, be able to directly book. However, it will also be on our website. So we're just trying to avoid having a lot of traffic to the website all at once. So Mike's nodding, but he might have more to say about that.
No, just a lot of traffic at the moment.
A lot of traffic at the moment, he said.
Okay, that's understandable. My other question was about the AstraZeneca vaccine, and I'm wondering if people should be concerned, or if you can allay any concerns about all the reports that we're hearing in the United States that the data on the vaccine is out of date, and that they need to do more testing on it. Should we be at all concerned about it here?
I haven't received anything from our ministry in Canada or, Health Canada regarding AstraZeneca, other than that it is out there available and it is safe and effective. So no concerns that have been brought forward. So I'm not sure what more data has been released in the States, but right now AstraZeneca is widely being administered through Ontario. So, and we're not seeing adverse reactions. They get reported to our health unit and also to Health Canada. So it's not like we're seeing anything unusual other than what is to be expected with any vaccination injection, which can be some soreness at the site, and sometimes there can be a headache, feeling tired. Those are all, common side effects, but nothing of concern at this time.
Okay, that's it for me. Thank you.
Any questions from AM 800?
Teresa, since the website's down, can you just tell us what school is under outbreak now?
It is Herman.
Are these linked to the past cases at Herman? I believe Herman was under outbreak last week.
No, this is a separate, it's in a different cohort. It's limited to a single cohort, and it is different than the other one.
Okay, thank you. And then switching gears to the 75 and over, I know Mike mentioned about the traffic on the website. I'm guessing you and the team are expecting a pretty busy day here?
Extremely busy, but that's not unusual, is it? But yes, and I think there's concern with Mike looks very concerned regarding the website.
I'm not sure if this is more for Mike then, but what kind of traffic do you see on the website on a regular basis?
Since the pandemic began, our numbers have been quite high. I would say in 1 month, we would get close to what we would get for the whole year. So WeChew.org has become a really reliable source of up-to-date information about COVID-19 and continues to be. I think what's happening right now is a lot of people are going to the website hoping to book quickly and are hitting refresh. So if they're refreshing the page often, it's just creating more traffic unnecessarily. And we will be up and live with the new system at 12 noon. We will promote on Facebook, Twitter, LinkedIn. We'll send it out through email. So everyone will have an opportunity. They don't have to go only to the website. It'll be shared throughout.
Thank you.
Any questions from CTV?
Yes, good morning. You mentioned the coverage rate for 80 plus. What was the target, and is this kind of in the range that you were hoping for?
Oh, so I'll say our target is like 100% of anyone who wants it, and because we know this is a vulnerable age group, the 80 plus group. So 82.8%, that's really quite good. But we know that there are more people out there, and we will continue to vaccinate and try to get as many more people, well now 75 and older, but 80 plus and older. So our EPI pulled the number last night, and we were pretty happy with that.
And tomorrow is 2 weeks since Dr. Ahmed started his leave. Do you know, is he returning tomorrow?
Tomorrow is Wednesday. I don't know when exactly Dr. Ahmed will be returning, but he will be returning.
Okay, thank you.
Any questions from CDC?
Yes, we've gotten some reports that pharmacies are running out of vaccines. Do you have a sense of what the supply is like right now?
So the pharmacies that were part of the pilot, the 57 pharmacies, we do keep track of those that have vaccine, and some pharmacies do not have any, and others still have some. So you actually have to, I would say, go on our website and check out the pharmacies that, and be calling them to see who has vaccine. We know that there's still vaccine at some of the pharmacies. I don't know when or, more vaccine will be received. We were on a call yesterday with the ministry, and they hope to expand the pharmacy rollout and give more pharmacies AstraZeneca across Ontario. So we'll have to wait and see what our allotment is. But right now, there are still some pharmacies left with the vaccine, but we hope it moves quickly because we know this vaccine will expire on April 2nd.
Thank you. How long do you think it will take to get through everyone who is 75 and older who wants a vaccine and offer up vaccinations to those who are 70 and older?
So we know through our epidemiologists that we have about 15,000 people in Windsor and Essex County that are 75 years of age or older. And we also know that we have a certain percentage of our 80 plus that continue to would like the vaccine, or hopefully would like the vaccine. But with those numbers and with this, the amount of vaccine that we have, we should move quickly with those 75 and older, like in the next couple of weeks. I say that, hopeful that we'll have the vaccine to do everyone that's scheduled an appointment. But we'll continue to monitor that. But the ministry guidelines is once you've reasonably reached everyone in that age priority, like that 5-year age 75 to 80 and 80 and above, then you can move down in 5-year increments. So we'll monitor it. As you know, we're tracking every dose that we give, and we know exactly we will know everyone who's has an appointment booked, and we'll move when we can move to a lower age category.
Thank you.
Any questions from Blackburn?
Hi, you mentioned that 82.8% of those 80 and up have been vaccinated now. Have you gotten in touch with all of the people who have pre-registered but not had their vaccine? And when could they expect those calls?
So we have been calling everyone, and they'll be able to be booked like this week or as soon as we can get them booked. But on the weekend and into this week, we'll continue to call people.
And do you know how many people that is?
I think right now we're less than 100. I don't even know if it's that many, but that we haven't made contact with.
Okay, thank you.
Any further questions from Windsor Star?
No, thank you.
AM 800?
No, thank you.
BTV?
No, thank you.
CBC?
No, thank you.
And Blackburn?
Nope, I'm good.
Okay, thank you, everyone.
Bye-bye.
Thank you.
Thanks, bye.